Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Alok Kumar from Apollo Cradle and Children's Hospital. He is going to talk about pediatric constipation. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Good afternoon, everyone. My name is Dr. Alok Gupta. Today we will talk about the pediatric constipation, which is very frequent problem nowadays. We can see almost up to 30% children suffer from constipation. Nowadays, there are many causes behind this. But before going to constipation, first we will discuss about normal stool pattern in children. Normal stool pattern varies with the age. In first 6 months of life, uh, it basically depends upon the type of feeding, whether baby is on breastfeed or formula feed. Babies who are on breastfeed fast stool more frequently, and these babies have soft semi-solid stool, while the top feed babies have more firm and less frequent stool as compared to breastfeed babies. Less than 1 month of the age, frequency of stool is 3 to 4 times per day is quite normal, while more than 1 month of the age, 1 to 2 stool per day is quite normal. After age of 1 year, 1 stool per day, well formed is quite normal. Now, uh, when we define the children as constipated, basically when there is delay or difficulty in passing stool, which is persisting for more than 2 week duration, then we can say the baby is having constipation. And this constipation should be significant to cause significant distress to the baby. Uh, there are two types of constipation. One is functional constipation, and that is pathological constipation. And up to 95% children have functional constipation, and only 5% have the pathological constipation. That is, they have underlying cause, underlying disease which is causing the constipation. And what are the features of constipation? How we can say that this baby is having constipation? This baby will have the painful stool. This baby, some babies, they pass small amount of involuntary stool in the undergarments. There is also known as swelling of the undergarments, which is once or twice a week also, very significant. These babies have large diameter stool. There is excessive stool tension, and which also known as withholding maneuver. In this, when babies having urge to defecate, they will cry in pain. Their face will turn red. They will cross their leg. They will squeeze their gluteal muscles, and and they push their stool up in higher in the rectum vault, so that they have reduced urge to defecate. Parents misinterpret it as babies trying to pass the stool, while it is other way around. Babies withholding the stool, because passing a hard stool is very painful experience of them for them, and they want to avoid this experience. And frequently in such babies, we have seen that baby also have less oral intake. They usually refuse to take food because they know if they will take food, they will again have the urge to defecate. So less weight is also common in these babies. It is we should keep in mind that consistency of the stool, like the hard diameter stool, firm stool, is more important than the frequency of the stool. If baby is passing stool alternate day, but stool is baby is having painful stool, hard stool, or sometimes bleeding in the stool, then also we can term this baby as constipated. Now we can come to the organic causes of constipation. There are some diseases like Hirschsprung disease, anatomic malformation, some neurological and spinal causes can also cause the organic constipation. Sometimes celiac disease, excessive lead poisoning, and some drugs also cause the constipation. And there are some red flag signs of organic constipation. Then, when these signs are present, we can which indicate that the children have organic constipation as compared to functional constipation. And the treatment is also depend upon the underlying cause of the organic constipation. Like These babies have frequent history of delayed passage of meconium soon after birth. Instead of passing stool in first 24 hours, which is normal occurrence in normal newborn babies, these babies usually pass stool second day or third day. Second is the onset of constipation early in infancy. Like in first 2 or 3 months, this baby will develop constipation. Like in hypothyroidism, this baby have very hard stool, along with frequent prolonged neonatal jaundice. Then we can say these babies are having the pathological constipation. These babies are frequently failure to thrive. They are less weight gain. Their weight percentile is less, and their stool are usually ribbon shaped. They will also have the recurrent green vomiting, which is known as bilious vomiting. Then we can, which indicate that babies have having the organic cause of constipation. In some babies, along with constipation, there are recurrent history of pneumonia as well, which is indicative of cystic fibrosis, where constipation is very common. Treatment of organic constipation is as per the cause. Like in hypothyroidism, we have to start thyroxine hormone as early as possible. Like this in Hirschsprung disease, these babies, some babies undergo surgery as well for their uh, constipation. Now we talk about the functional constipation. How to identify the functional constipation? Age of onset is usually 1 to 2 years, when mostly after introduction of the semi-solid feed, around 6 months of the age, when we start the weaning of the baby and we put the baby on solid food, this baby usually develop the constipation. This baby have rento posturing, also known as the withholding maneuver, which I just described, which baby will be standing against the wall with their leg crossed. This baby will cry. So this baby sometime when they have urge to defecate, they will uh, hide behind the doors or hide behind their favorite pets to avoid the defecation. All these attempts are the attempts to basically the withhold the stool, and so that they have not to experience the painful defecation. This baby usually have dental food fecal incontinence as well, in which small amount of fecal matter will stain their undergarments. How will we will manage the functional constipation? First is the parental counseling. We have to counsel the parents about the cause of constipation, as well as the adherence of the treatment is more important, because constipation treatment takes around 3 to 6 months. And parents must be stressed upon the long duration of treatment, because many parents stop the treatment after 10 to 15 days when they have small abdomen constipation, due to which the this constipation again reoccurs after 15 to 1 month. Again, this vicious cycle is going on, which is very painful for the baby as well as the parents. Second, diet. Diet is very important. Diet which is rich in the fiber, we have to give, like fruits and vegetables. In fruits, the fruits having peel like apple, papaya, guava are very beneficial for the babies. And some homemade fruit juices are also important for the management of constipation. Baby should drink plenty of water, and milk intake is very important. We have seen that many parents have give milk up to 2 liters per day. Milk does not have any fibers, which is very important significant cause of constipation. So we advise baby to parents to give milk up to 500 ml per day, not more than that. Excess milk more than 500 ml per day uh, is worsening the constipation. Third is the toilet training. If baby is more than 2 years of age, we must focus on toilet training of the baby. Baby must sit on the toilet for at least 3 to 5 minutes after each major meal, because after having meal they usually having urge to defecate, and this defecation takes place at least take around 1 to 2 weeks to happen, but parents must make a habit to put the child on the toilet seat regularly. There is rule of one, that is one routine, one person, and one place, and for the baby, so that baby is used to that condition. Third is pharmacotherapy. When this diet and toilet training is not showing effective result, and there is long-standing constipation, or there is blood in the stool, we have to frequently give the drugs to treat the constipation. This pharmacotherapy you give in two phases. First is the disinfection phase, and third is the second is the maintenance phase. Disinfection phase, what happened during constipation? The hard stools are there in this rectum, which is very difficult to pass because diameter of the anus is very small as compared to the diameter of the hard stool, and the stool when passes through the anus, they scratch the mucosa, resulting in the mucosal tear that causes pain as well as bleeding to the baby. So to remove that stool, we usually give the suppository, dulcoflex suppository, or we give large amount of the laxatives to disinfect this hard stool from the rectum. It usually takes around 3 to 6 days for disinfection phase. One can do disinfection at home as well as in hospital setting as well. When disinfection phase is over, we usually give maintenance therapy for at least 3 to 6 months. This is very important because babies have improvement in constipation within 15 days, and parents really stop the treatment. So parents must be stressed upon for the long duration of treatment. There are two types of drug we usually give. First, lactulose. Second is the polyethylene glycol. Lactulose we usually use in less than 1 year of age, which is very effective and very effective. And more than 1 year of age, you usually use polyethylene glycol because in older age, babies have less recurrence rate, more effectiveness, and we have seen that almost all the babies which are having functional constipation, they they are cured of their constipation within 3 to 6 months. Thank you. Any question? Any question? There is no question. Thanks.